Good morning to my Charisma amigos. Welcome to another episode of the Charisma Effect. Today, in our health is wealth issue, we are going to discuss men and their prostate. Prostate issues are common among men from all race, class, and ethnicity. So today we are going to explore problems men face with their prostate, the most feared issues, symptoms, early detection, and treatment. What is a prostate? It's a walnut-sized gland in males just below the bladder, and it surrounds the urethra. The urethra is a tube that drains the urine. The primary function of the prostate gland produces some seminal fluid. So 30% of the fluid in the sperms were made in the prostate gland. That fluid nourishes and keeps the sperm healthy, and it also transports the sperm. It keeps the sperm mobile. So you see there's a direct correlation between prostate health and male reproductive health. There's a direct correlation between prostate health and male reproductive health. So that most of those fluid in the sperms, the seminal fluid, were secreted in the prostate gland. One important fact you must know about prostate: the gland enlarges with age. Common problems of a prostate is benign enlarged prostate. Sometimes they have enlarged prostate. It's not cancerous, the process is just enlarged. And you have what they call the inflammation of a prostate, but the most common, feared, and life-threatening one is cancer of the prostate, most commonly known as prostate cancer. Prostate cancer is the uncontrolled growth of cells in the prostate gland. Again, prostate cancer is the uncontrolled growth of cells in the prostate gland. Prostate cancer does not, or sometimes it really cause any symptoms. Sometimes when you start to see symptoms, that is when it's the advanced stage. Some of the symptoms of prostate cancer is difficulty passing urine. I remember in the country when they say the man have stoppage of water. Oh, Mr. Brown have stoppage of water. No. At the time, Mr. Brown have severe prostate issues. Another symptoms of prostate cancer is a frequency in passing urine. That's how some symptoms that some people face. Frequency in passing urine, blood or semen in the urine, bone pain, sudden weight loss, and tiredness, excessive tiredness. Note that men over the age of 50 have a higher risk factor of developing prostate cancer. Again, men over the age of 50 have a higher risk factor of developing prostate cancer. And also, what should I have noticed, that black men have a more higher predisposition of getting the more aggressive form of prostate cancer. So the black men are highly predisposed to get the more aggressive form of prostate cancer. What I realize with some Jamaican men though is they're reluctant to get screening because of what the screening entails. That rectal exam that the urologist recommends, Jamaican men shy away from that. But there's other tests that can detect early cancer. Is what they call a prostate specific antigen test, which is a PSA test. That some men will do that. They will do the PSA test. So at least some screening is done in some men. Treatment is personalized based on the stage of the cancer, and the urologist tends to monitor slow growing tumors before recommending any form of treatment. But there's a procedure they call a prostatectomy. That is a removal of the prostate gland that is done It is done to remove the prostate then totally. Radiation and chemotherapy is also other treatment option. But one undisputed fact about prostate cancer is that it is treatable when detected early. Again, one undisputed fact about prostate cancer, it is treatable when detected early. This is your diva, Charisma, saying, as usual, love God, love yourself, and be blessed. This is a charisma factor where expectations meets reality. Peace.